Begin by placing self-supporting plastic cheek retractors. Place a tongue bite block in the molar region and instruct patient to hold in place with gentle but firm biting pressure. Ultradent recommends using the isoblock or prop guard. Completely rinse and air dry teeth. Apply a 1 to 2 mm wide barrier of Opaldam on the gingiva. Seal the interproximal spaces. Overlap the resin approximately 0.5 mm onto dry enamel to seal. Extend the resin one tooth beyond the last tooth to be bleached. Visually check that all gingival tissues at the resin margin are covered and a seal is established. Light cure the resin approximately 10 seconds per tooth. To mix the activator with the bleaching agent, ensure the red and clear syringes are securely attached together. Quickly and forcefully press the clear plunger into the middle clear barrel. Using your thumb, press the chemical from the red syringe into the clear syringe. Continue by reversing this action. Mix a minimum of 20 times rapidly, 10 times for each direction or side. Press the entire mixed contents into the red syringe. Remove the clear syringe and dispose. Twist a 20-gauge micro FX tip onto the red syringe. Check material flow on cotton gauze or a mixing pad to ensure evenness of flow before using intraorally. If resistance is felt, do not proceed. Attach a new tip and test again before using on the patient. Apply a layer of Opalescence Boost bleaching gel approximately 1 mm thick over the labial surfaces. Extend the gel slightly onto the incisal or occlusal edges. For optimum effectiveness, stir or agitate every 5 minutes. Leave each application of gel on the teeth for 15 minutes and remove the gel using suction only. To prevent Opalescence Boost from splattering onto the soft tissues, do not use water to rinse during the initial suction. Ultradent recommends using a Luer vacuum adapter with a Sergi tip. Use caution not to dislodge the resin barrier. After all visible gel is removed, follow with a gentle thorough rinse. Direct the water toward the incisal edge while using high-volume suction. This process may be repeated up to 6 times unless the patient becomes overly sensitive. Evaluate the shade change after each application. The cured Opaldam resin is quickly and easily removed in one or a few large pieces. The total procedure typically lasts 60 minutes, with 3 to 4 applications occurring. If additional whitening is desired and no significant tooth sensitivity is observed, schedule the patient for repeat treatment at least 3 days following the initial treatment. Be certain to read the product instructions, warnings, and information for the patient contained in the package, and advise the patient accordingly. Most all clinicians who provide in-office bleaching follow up with tray bleaching. This assures bleaching further distally in the arch and/or to achieve ultimate level of whitening. An office can choose to make a custom tray for the patient to use as a follow-up or use the preloaded Opalescence Tray White Supreme tray as they require no additional impressions, models, and lab time.